Today we talked to Dr. Don Fowls. He's a psychiatrist and has been a consultant for insurance companies, managed healthcare, and how to keep care affordable and improve mental health nationally. Today we talk about a lot of different things that I found fascinating, talking about how mental health is something that everybody can benefit from depending on your circumstances, even to how to make care more affordable and accessible. We hope you enjoy this episode. All right, today we're really happy to have Dr. Don Fowls with Don Fowls and Associates here with us. Dr. Fowls is one of the most knowledgeable people that I know about insurance. He's an expert in obviously psychiatry. That's what his doctorate is in. And so he's an MD in psychiatry. And then in addition to that, he's been a consultant. He's done just about everything you can imagine as it pertains to the health insurance world. So thank you for being on the show today with us.
My pleasure. Glad to be here.
All right, so first off, just to get people a small intro of who Dr. Fowls is, can you tell us a little bit about your story and your background?
Yeah, sure. Just real quickly. I grew up in Cincinnati, and I went to Dartmouth for college. I saw the country by way of training, so I went to Dartmouth in New Hampshire, North Carolina for med school, and then UCLA for my residency. Along the way, I got married to my wonderful wife. Been married for 45 years.
Oh, that's awesome.
And we have 3 boys. And I helped start and grow 3 companies in the healthcare world. Probably the most notable one is Value Options, which I came in. The company was already up and running, but I came in pretty early as the chief medical officer, and then also wound up running business development. So before that, I actually did a couple years of internal medicine before I went to psychiatry. So I've seen that a lot of different parts of the world. And then over the last several years, I've been doing some consulting with health plans, health systems, you name it, whoever needs a little help in healthcare. Yeah,
Dr. Fowls is, everybody wants to have him on his team, on their team, so I'm not surprised
You're very
that
kind.
They say that. So let's get into some of that. So Value Options, what type of a company was that, and what did you guys focus on?
Well, it was actually a great company. It started out as Options Healthcare in Norfolk, Virginia. It was owned by a psychiatrist, and this guy who was the CEO at the time, Jeff McWaters, actually went on to found Amerigroup, which was acquired by Anthem. But I came in as the chief medical officer, the first chief medical officer, and then I also wound up overseeing business development. And basically what Value Options did was it managed behavioral health care benefits for employers, health plans, health insurers, Medicaid, Medicare, TRICARE, anyone who needed some help with managed behavioral health.
So for those that don't know, what is managed care? Like, what does that actually mean?
Managed care it's basically, in a nutshell, it's an effort to try to manage the health care benefits of an insurance plan. And so basically managed care companies contract with employers or states through Medicaid or with Medicare, and basically are given benefits to manage. That's essentially what it is.
And so their job is trying to make care accessible, but also keep costs down and everything like that, correct?
Those are the overarching.
Okay. So what do you feel like, I mean, this is a big issue in our country of people thinking that care is maybe not accessible and that care is not affordable, right? So I know that you have some deep expertise in this area. What do you feel like are some things that we can do nationally, we can do in the state level, we can do as a company level to try to increase accessibility to care and to make it more affordable?
It's a great question. And if there's one thing I would say, is to get people together to collaborate and solve problems. Because one thing that's been, our system is so siloed and so fractionated.
Yep.
You got, employers, states, health plans, health systems, providers, and they don't always communicate very well. And the poor patient and family are left to navigate this system, which is virtually impossible to navigate.
Absolutely.
And part of the problem is everyone's kind of been stuck in their silo, and they need to come out and talk with each other to help solve problems.
See, we talk about this a lot on the healthcare side, of healthcare delivery side, which is, take a patient that's in pain. They have the question of, do I go to my primary care? Do I go to a chiropractor? Do I go to a PT? Do I go to an orthopedic surgeon? Do I go to a neurosurgeon? And there's all these options. And they're like, I have back pain, but I just don't know where to go. And so you may go to one doctor and they say, you know what, we need to refer you over here. and then you go to that doctor, and those two doctors never talk to each other a single time. So every time you go to a doctor, it's like starting from zero. And that's what we call fragmentation. It's that same fractionalization you're talking about. And I think there's a big issue on the service delivery side, but you're saying that another reason it's expensive is because that same fragmentation is happening on the back end of all of these payers don't talk to each other as well. So how do we get people talking? How do we bridge the gap?
Well, I think one thing we've got going for us is people in healthcare. There are a lot of good people in healthcare in all these different areas. Health plans, providers, you name it. There are a lot of good people, and they actually do want to do the right thing. But at least when I was in med school, no one taught me to say, hey, it's not just about you as a doctor, it's about a team of people who you need to solve problems. So some of it's educational, but then some of it's leadership too, and having the people in place to bring people together to collaborate and to talk, because these problems are complicated and no one or two people are going to solve them on their own. They're just not. And so you need the ultimate customer, which I call the employer of the state. You need a health plan, you need the health system, you need the provider people to get together to really figure things out. It's really apparent in behavioral health.
Yeah. So let's talk about behavioral health. So what is, let's take it super simple. What is behavioral health?
Behavioral health is really, it's the science that has to do with mental health and substance use disorders. And some people would include intellectual and developmental disabilities in that too. But it's a broad term that really includes those major areas.
Okay. So I know that there's been a lot of increased attention on behavioral health in the last few years, which I think is great, and it's very good that it's finally getting the attention it needs. Why do you feel like there's been, this has been a need for a long time? Why do you feel like it's getting the attention now, finally, that it hasn't been before?
Great question, and but one of the reasons, two big reasons. One is technology. Okay. Our world's much more accessible to us, and another big reason is integrated data. Is before, not only were providers and everyone siloed, but the data has been siloed. Got it. So that a health plan, even within a health plan, behavioral health and medical data were segregated, and pharmacy data to boot. What's happened is the systems have improved, is that the data has now been integrated, so people have the opportunity to see the person as a whole person. Before that, believe it or not, that was not possible. But now they're looking at, this person that's got diabetes, congestive heart failure, hypertension, asthma, oh my gosh, they also have depression, go figure. They have a lot of chronic problems, and anyone would feel a little down. Absolutely. And so it's those factors that have really, among others, that have helped bring it in. So you would say that the increased integration of data and the advancements of technology have helped a lot to bring behavioral health to the forefront, which I love. I love that answer. Do you feel like that's one of the ways that we will continue to improve healthcare? Again, that question of how do we make it affordable and accessible, where do you see that going as we continue down this path, whether it's telehealth or other things? How do you see that improving accessibility and affordability? I mean, I think one thing that really has improved things, and this is, if there was anything positive that came out of COVID, telehealth was one of them. And because before, you think about people, you got to get in the car, take care of the kids, get in the car, go drive to a provider, and if you're late, God forbid, then you wait even longer than you might wait otherwise. Or you get canceled. You get canceled, and then you got to drive back, so there's a lot of time. Whereas with telehealth, you just go into your den or your living room, and you're there with your provider. So it's like, this is so easy. Convenient. Oh, it's so easy. Now, it doesn't work for everything, by any stretch of the imagination, but it works for a lot of things. And it's really funny. During the COVID thing, I was part of an advisory group to the Governor Ducey, and he asked about behavioral health and about telehealth, and I talked to him a little bit about it. He goes, "This is really great." He goes, "Why take you guys so long to catch on?" Well, we're healthcare. We take a little while, but it really has helped a lot. And I think technology has to help both members and providers and health plans to do things more efficiently.
So as a psychiatrist, do you feel like that, and behavioral health in general, do you feel like that's one of the areas where telehealth is a really good modality for the long term to be able to help patients?
Yeah, I really do. There are a lot of caveats to it. I think what I'm hearing from my friends in the field, both doctors and non-MD therapists, is the more complicated the patient is, the picture is, the more the need for being in person, at least for some of the visits, not all, but some of the visits. And and especially when it comes to complicated medication plans.
Absolutely. Yeah.
And you just need to be able to see someone, because sometimes, someone, you're only seeing part of them, and they may have a tremor in their foot, their leg that you're not seeing.
Yeah.
And yet it's a side effect to the medication that they really need to know about.
Yeah, I agree with the statement you said as far as like when you can decrease barriers to entry, such as driving and planning and all those things, compliance goes up. And we know that when compliance goes up, usually outcomes improve, right? So if a patient goes to their visits and they take their meds and they get the care that they're supposed to get, obviously they should get better, right? And if they're missing those appointments because it's hard to find, okay, I have to babysit, or I have to get the kids, I got to drive through traffic, I need to find a ride, all of those things are barriers to people getting care. And when you can remove those, it's easier to stay compliant with those visits, follow-ups, and everything like that. So I agree that's a huge improvement. But I love that you brought up the other half of the coin, which is there's certain things that you can't do over the phone that you can do in person,
right.
And both are important. And so how do you feel like we navigate, in an increasingly technology-based world, how do we navigate when it's going to be the best time to see people in a telemed type setting versus needing to be in person? Complexity of the disease makes sense. Is there anything else?
Sometimes age.
Okay.
Younger people tend to be more tech savvy than older people.
Yeah, that makes sense.
That's one thing. Another thing that doesn't get that much attention, but if in a rural area or even in a frontier area like Arizona, the technology just isn't there.
Yeah.
Now it's improving all the time, but people don't have access to the internet, and so the telephone becomes a really important capability. I mean, in the northeastern part of the state, there may be a provider, a psychiatrist, 200 miles, wow, something like that. And so, to get in the car and drive for that appointment is non-starter.
Not realistic.
Yeah.
Okay. So let's change directions a little bit to pain care. So obviously, at Pain Doctor and Arizona Pain, we treat a lot of people that suffer from chronic pain, different conditions, acute pain, car accidents, all sorts of different pain issues. How important do you believe that behavioral health is to patients that are dealing with chronic pain?
I think it's incredibly important, even for people that don't have formal diagnoses, so to speak. But if you've been in a car wreck and you're hurt, it's traumatic. It is for any human being walking this earth. I mean, it just is traumatic, and it creates a lot of anxiety. Like, what's happening to me? What's going to happen to my family, my job, my this, my that? And so there's the acute stressful period, but over time too, as things settle down a little bit, there's a tendency to become demoralized, depressed.
Yeah.
Any of us in these situations. I mean, I played some sports and I had some injuries, and I remember I had to sit out for a month, and it was one of the most depressing times I've ever faced. Just watching all my buddies playing, me not being able to, is horrible. But I think that those things are very real. And I think one thing that's really helping the discussion these days is mental health is sort of coming out now.
I agree.
People are much more aware for a variety of reasons, but people are much more aware and much more willing to talk about it than they were before.
I agree. And going back to pain care for a moment, I mean, you think about it, whether it's a car accident or let's just talk about chronic pain. Like the story that we hear from patients over and over again is, I first hurt my back and I thought it was going to go away, so I iced it, I rested for a moment, and then I realized I couldn't golf anymore, right? And then they stop golfing. And then we hear that they, time goes by and their back starts to hurt again, and they're like, well, I realized I couldn't go on walks with my friends anymore. And so I stopped going on walks with my friends and my back pain went away. And then the back pain comes back and it's like, I was playing with my grandkids and my back started to hurt, and that's when they come in and see us, right? Because they're like, I wasn't willing to give up playing with my grandkids, so I came in. And so what we've seen is people limit their lives to avoid pain.
Yeah.
Well, the problem with that is if you limit your life, don't be surprised if you see depression and anxiety and all of these things.
Really true.
You're not going to be happy if you're living half the life that you used to live. And so in that type of a setting, I do believe that we can take care of the pain, but if we don't deal with some of the mental health that comes from what the pain's done in your life, then even when you're healthy again, you might not be mentally healthy and back to the state of happiness. And so what do you feel like is the best route for those people that have that kind of story or condition I just laid out of because of their pain, they're depressed? What's the best way to get them to interact with a behavioral health provider?
That's another really great question. It's a challenge because people are a little reluctant.
Mm-hmm.
You know, maybe they went before and had a bad experience, or maybe they are just afraid to go. And so it's really an educational thing. Mm-hmm. And I think you know, it really helps to be in a clinic setting that has access to, you know, not just one modality but several modalities.
Absolutely.
You know, it's much more integrated. And then because pain itself is it's not just the physical pain, it's a lot of other things that go with it, including the mental health part.
Yep.
And so, you know, I think having people who are aware and able to educate patients on the importance of it is really, really helpful.
So as a healthcare provider, what do you feel like let's say for advice for other practices or providers that are dealing with these patients that are in pain, what's the easiest way to kind of gently encourage your patient to be able to see, you know, a behavioral health specialist of some type?
I think, you know, the trust factor is so important. Mm-hmm. And so for the you know, when you put, you know, someone walks in, they're a patient, and it's very clear they need to see someone. It's that relationship that's come before that gives the provider the opportunity to say, hey, look, we're doing what we can here, but I really think you need some additional help from a professional who really helps on the emotional side, it's the mental health side.
Yeah.
You know, no one's saying you're this or that.
Yeah.
But you know, anyone in your shoes would be feeling down, and sometimes it develops a biological part of the depression.
Yeah, absolutely.
That absolutely needs a professional attention to assess it and to get you on the right treatment to take care of that, and you'll feel a whole heck of a lot better. So it's worth a shot.
I love that. And in fact, I think that you nailed on something of having, it's really important for providers to create great relationships with their patients so that there is that trust. And that's the foundation. If you don't have that, you forget everything else, right?
Really
but then the next step is really important because in a pain type setting, especially if you bring up, hey, we want you to see a psychiatrist, right? They're going to, it's natural almost for them to think, you don't think my pain's real? Or you think that, you know, I have, it's a scary thing seeing a psychiatrist or behavioral health person because they're like, well, I'm not crazy. This is real. This is hurting me. This is destroying my life. But if you frame that properly, and what you just said, if we're not doing it because we don't think it's real, but actually it's to give you the emotional healing and the emotional support. And it's not the psychological as much as it's the emotional. And how you brought that up, I just think that's really, really smart of, you know, if you ask somebody, you know, 20 years ago, whether you need to see a psychiatrist or something like that, it's like, why are they seeing a psychiatrist? There's a stigma to it. And I do think there's an emergence, especially recently, of people saying, it's okay to go to a therapist. It's okay to go and look after your mental health. So in this blossoming mental health kind of revolution of where it's encouraged to be in a good mental health state, how do you feel like we can continue to push that momentum forward? Because it's not just in pain care. I mean, you look at life in general, and especially in North America, in the United States, we live in a very high stress, high anxiety world. Who should be seeing a mental health or behavioral health provider?
Well, I think certainly coming from the pain environment.
Yeah.
I mean, one of the best things that's happened over the last 10, 20 years is we've remembered that people are whole people.
Agreed.
We lost sight of that for a while as a culture, and so we sort of pigeonholed people into medical and behavioral. Now we realize they're whole people, and so and most health problems are whole person problems. In other words, they're not just medical, they're not just behavioral, They're both.
Yep.
And so I think really coming from that perspective and educating the patient, the person in the room that way too. It's like, no one's saying you're crazy. No one's saying, it's just like we as people have physical beings, we have emotional beings too, and we got to account for all of them. We even have spiritual beings. And, you know, we have to take care of all that sort of stuff.
So, where, like, for maybe the listener out there that's saying, you know, I realize I have some emotional stuff, but I don't know where to start. What's the best way to start going to a behavioral health specialist or a mental health specialist?
I think a couple things here. One is there's some providers who are pretty savvy and who will know who to refer to and may have relationships with someone that they really trust.
Yeah.
And it really helps if a provider can say, hey, I know this person, I trust them, they'll do well by you. Mm-hmm. Not all providers are like that. So the other thing is word of mouth. It's people, people that you trust, loved ones, family, friends. People are often surprised how open and willing people are to help out in these situations. Say, hey, I've been to someone too. I've had some problems, and here's someone that I think is really good. What I would discourage is using today's yellow pages, just going on the internet and trying to find someone and say, oh, they look good, let's go see them. That's really a hit or miss, and more often than not it misses, and so those are some of the things I would suggest.
I think those are great suggestions. So there's a lot of different types of people that may fall into these categories. So let's just talk about this for a moment. So you've got who I would say is the top of the food chain in this behavioral health, mental health is going to be the psychiatrist, right? But you've also got like psychologists, you have social workers, you have like all of these different providers. You even have these modern gurus, which I'm curious to see what you think about this, which is like the life coach and coaches rather than therapists. What's kind of your perspective? Are they all good to some degree, or are some people maybe going to one and should be going to another? How can they differentiate what they need?
It's very interesting because I think, at least as types, they're all pretty valuable. They all do different things too. And so like a psychiatrist is really good at the medical part, evaluating, really figuring out what's going on, and then making treatment recommendations and then doing the medication. What psychologists are really good at, and social workers and even master's level therapy, is therapy. Mm-hmm. When I was in practice, some of the best therapists I had were the least trained people.
Interesting.
They were practical, down to earth. They didn't have an MD, a PhD, or LCSW by their name. They may be licensed, they may not be licensed, but they were phenomenal. They just knew how to relate to people and work with people. Coaches have a role too, because they're coming from a little different bent of working on life problems, like how you're doing at work, or even for a CEO, a coach for a CEO, how you deal with a leadership team in a company. There are all sorts of different coaches, and so I think then they're good. I mean, good people doing all sorts of those things, and there's some ones that you probably want to stay away from too.
Yep.
So,
well, I think that the core part of that, what you said, is like, one is depends what you're dealing with, what you need.
Yeah.
Right.
Yeah.
And then the second one is with each of those, it depends on, like, the best way to judge that is not just your circumstances, but other people in similar circumstances asking, hey, who helped you out? Or do you have people that you've worked with this? So as a CEO, it'd be like talking to other CEOs. Do you have a good CEO coach? Or if you're dealing with mental health issues, hey, who have you gotten a good help from? Because as you just said, if I'm interpreting this right, the core thing that makes a good therapist is being able to relate and connect with you, not necessarily the degrees behind their name. Is that accurate?
It's really true. I mean, one of the big issues in healthcare is dealing with this now, but it's the whole thing of engagement, patient engagement. And it used to be 10, 15 years ago, even 5 years ago for that matter, a health plan would call someone out of the blue. You're sitting at home, watching TV, talking to your spouse, and you get this call from your health insurance, like, why are they calling me? Who is this? Goodbye. and everyone goes, well, they're just not ready for help. Well, no, that's no way to engage anyone.
Absolutely.
And so I think that the whole thing about engagement is very, very important.
Well, and you just went back to the fragmentation, right? It's like if the healthcare plan is the person trying to say, we have a lot of, behavioral health issues, let's call them and offer it to them, right? And they think that they're solving that problem without actually relying on the rest of the healthcare team and saying, hey, providers, we believe there's a behavioral health issue and we could push this forward. Can you help us to identify people and to say, hey, this could really help you? And if we rely on each other as a team, that's how we solve this. And, what you just said is, like that perfect example of one silo trying to solve the whole problem on their own, and it's just never going to work.
Never works, never will. And I think, the industry's changing. It's evolving.
How so?
Well, it used to be managed care companies were, out in the distance. They were brought in because costs were run away.
Yep.
And they needed to be contained. And also the quality was very variable. Okay. There were some good providers, some not so good providers. The thought was managing the care would help that.
Yeah.
The problem was that the health plans were so distant that from the point of care that, but what's happened, especially with people who are sicker, who have more complexity, more, multiple medical problems and behavioral health problems, some substance use problems, is that the recognition is that, well, we as a health plan, we can only do so much. We can authorize some care, we can pay some claims, but we really need to rely on our network providers to work with these people as a team too. So rather than being a top-down thing, managed care, provider, patient, the whole thing gets turned on its head, and managed care becomes a support system in that provider-patient relationship.
Oh, that's
It's
cool.
an entirely different way of looking at things.
And you feel like this is the new model that's going to help
evolving.
change?
And some plans are more going in that direction than others, but where you really see it is with people that have complexity. And the health plans have tried to provide care, but they just can't. And so they're looking at their network providers to help do that. And there's some really great examples here in Arizona where the health plans have actually supported behavioral health providers coming together to create a system of care so that it's a lot easier to navigate.
So let's say that you're a healthcare provider out there and you feel like you're delivering the best care out there. You really care about your patients. You're getting good outcomes. How can you make sure to start a relationship with either the insurance company or a managed care group to be able to say, hey, we're doing great stuff. We want to be part of the conversation. What's your best advice to them that want to be involved?
The best advice, first off, everyone thinks they're providing good care. Well,
That's
I've been
true.
on the health plan side. There's never been a provider that's come in and said, I'm really providing bad care. It just hasn't,
They don't do
it
that,
just
do they?
hasn't happened.
Yeah.
And so everyone thinks that, but the differentiator is data. It's like, prove it, and prove it with the results and the outcomes and the data that you show. So out of 1,000 patients that you saw over the last few years, whatever, what happened? How could they get into care? Of the things that brought them in, their target signs and symptoms, did those improve or not? Were they happy with it? And was it cost effective? And you can actually create, as a provider, a report card that shows those handful of things. And you can go to the health plans, you can show it for an individual member, but then you can aggregate it by a population. And and it really plays well with the health plan and say, hey, not only am I saying it, but I'm showing you with data that we actually do what we say we're doing.
So that's like the most important thing then for providers to be able to say, I can show that we're getting better results than other people. We should work together.
Yeah.
Okay. I love that.
And I think another thing that goes with this is, I guess I can say this because I'm a doctor, but us doctors are guilty of thinking I'm the doctor, so what I say must be right. Not so fast. And so another thing that we were never taught in med school very well was how to collaborate with others, how to work with others. So being able to bring the data in and not only say that you're doing well, but showing it, but also being someone who's good to work with.
Yeah.
That you are like a good human being who likes to work with people, and it's not all about you, it's about the patient and the team and trying to work with people. Makes a huge difference.
Oh, I love that. I love
Huge
that.
difference.
Yeah, I mean, you want to work with good people, and you want to work with people that can communicate and aren't going to be, so prideful that, anytime there's feedback that it's, I'm not listening to you and stuff like that. You have to be a person that's willing to collaborate, get feedback, and then adapt.
That's such a key point, because the natural human tendency is to get a little defensive when you get feedback. But that ability to remain open and to receive it and to hear it and actually digest it and make use of it, that's and it's actually essential to team sports, to team participation.
Absolutely.
So yeah.
I think there's a lot we can learn from team sports actually into business teams, right? Of like how they work together, how they create teamwork, what they focus on, and fundamentals over and over again. Like there's so much that translates to the business world. But keeping us back to this, because that one would be one that would be really fun to talk about, but take us way in another direction. One question I have that I like to ask everybody that comes on to the podcast is, we're dealing with an opioid epidemic. Over 100,000 people are dying from opioid-related issues. This is a huge issue. We're trying to create education. We're trying to help solve this. Every specialty we bring in has a little bit of a different perspective. So in your opinion, what are some of the ways that we can help to fight the opioid epidemic that maybe we're not doing, or maybe people are doing but isn't getting enough attention and we need to do more of?
Yeah, I think part of it's a complex problem with a lot of drivers, including behavioral health. I mean, some people get addicted because they're self-medicating a depression or anxiety disorder, or even one thing that gets underrepresented, unaccounted for is post-traumatic stress. People who have had abuse when they were growing up, physical, mental, sexual, you name it, and it's been so traumatic that they're not going to volunteer anything about it.
Yeah.
But that's a really big factor in some people turning to drugs to self-medicate, because what else can we do is the thought. So I think education is a big piece of this. It's getting the word out, and all these things that go on in the community are helpful. There's no single bullet that's going to solve this problem, and it takes time and a lot of effort, focus, and attention to do it. I do think that I think this is an area where leadership really does matter, and one of the things is we've been blessed with good leadership in our state, and a lot of the state leaders have actually taken up the call to do this. And
been supportive for sure.
Yeah.
Well, going back to what we were talking about earlier, I believe one of the things that I believe how we solve it is actually what we started with, which is we live in such a fragmented healthcare system. One of the ways to solve this is bringing multiple specialties together to talk and communicate. Yeah. I have a saying that I like to say, which is, when doctors talk, patients win. And I really do believe that when we can bring different specialties together and actually say, hey, what are you dealing with, and what are the patient issues you have, and we're talking and saying, hey, I can help with that. And if we do that, just like you said, I feel like that's a huge part of what solves the opioid epidemic.
It's a huge thing. Yeah. And it's certainly a lot of different constituents, but doctors in particular, since they're the ones seeing the patients. And I think it's so important to do that, because even doctors have different perspectives on opioids. And a lot of doctors are much better informed and much more on it than they used to be. Yeah. But it's still not uncommon to go into a doctor's office and get a prescription for 60 Percocet. It happens all the time. Wow. And it happened to my wife.
Oh my goodness.
My wife broke her ankle, unfortunately. It's all turned out well. It's good.
That's good.
But she had to go back for an appointment, and she was really asymptomatic. She was doing pretty well. And the doctor said, okay, well, just come back if you need anything. Don't worry. Well, he'd had to do a little procedure, but it was minor. It was a 5-minute thing, just to straighten the thing out. And without him knowing it, his assistant gave her a prescription for 60 Percocet.
Oh my goodness.
And I said, we don't. And my wife goes, what? And we just tore it up and threw it away. But that sort of thing happens all the time. And so I think you're raising a really good point. Getting doctors together to problem solve and educate each other too, is just to raise the awareness. Well,
one of the things, Don, that we've seen is, as healthcare goes through this whole technology revolution, just like we're going through in the world of technology revolution. You look at the advancement of technology, the advancement of AI, like all of these things that are happening. What's happened is everybody's trying to develop new and better surgeries, new and better medications, new and better processes, and they're doing a good job. But the problem is that if you're in your specialty, you can't keep up with all of the technology improvements for every other specialty that's out there. And so one of the things that we will hear from patients sometimes when we offer a service, it's like, how come nobody's talked to me about this before? How come my other doctors haven't talked to me about this before? And it's primarily because as we see these advancements in technology, it's like, for example, give a primary care, for example. They have their specialty, they're dealing with their patients, they care about their patients so much. But for them to know everything that's happening in pain and the advancements in pain and in neurosurgery and orthopedic surgery and ENT and all these things, there's no way they can keep up with all of it. And so don't be surprised if your specialist has some type of new innovative treatment they can offer you that you haven't heard about before because of just the fragmentation that we were talking about earlier. But I digress on that. I just really,
that's a really good point.
I feel like, again, the better we do at communicating, the better we can offer our patients the best service.
You know, one of the things that we did when I was at Value Options and in the other companies I've been in, I've also done this, is we brought different providers together in advisory groups.
Yeah.
So we used to call them clinical advisory groups. It started out purely on the mental health side, so we bring psychiatrists, psychologists, social workers, master's level, unlicensed people together, and we chose the leadership of a region or a state or wherever we might be. But we started out meeting monthly, and then we met quarterly. But those were great. Well, as care integrated, we started involving primary care and specialty docs too, and everyone thought we were absolutely out of our gourd to do it. They thought, these guys will never participate. The last thing primary care, especially docs, want to do is come talk to a bunch of behavioral health people. They loved it. Absolutely loved it. They were more diligent about attending than anyone else. And the interchanges were so rich. The first one was actually in Delaware, a small state of Delaware. But we had a clinical. It was so vibrant and the other thing, I'm a big believer in small teams get things done as opposed to huge, humongous teams that you never get anything done. But in this was the exception. We had 25 people in this clinical advisory committee.
Wow.
And we would meet for 3 hours, which is a lot of time.
It's a long meeting.
A long meeting. We had a break in the middle, of course. And we always had food. That was always important. But we always made sure we had an agenda, focused topics that people were interested in. But these discussions were so lively, and it helped us educate each other about what was going on in each other's fields.
I think that type of program is needed, and I don't know how we can encourage more of that, especially here in Arizona. Maybe it's already happening, I'm unaware, but I think that anything we can do to try to really create and increase communication between different specialties is going to be, in the long run, better for the community, better for the patients.
Yeah, it really is. It really is. Look, there are a lot of good people, well-intended people in healthcare working their tails off.
Yep.
And doing what they think they should be doing, but in that rush to do things, sometimes we forget the rest of the world.
Yeah.
And I think you're right, Justin. It'd be really helpful for the patients.
Well, we can look at ways to encourage some advisory communities here in Arizona. So, a couple more questions as we're wrapping things up. So one would be just kind of a fun question for a moment. If you weren't a psychiatrist and you didn't go into that, what would you have gone into? Like, let's say healthcare was off the field. What would you have gone into?
I probably would have gone into the business world. I come from a family of business people.
Okay.
And my through generations, this company was in the family, and my dad was became the president and CEO, and actually grew it into a multi-state thing, and it was very successful and everything. But the thing that he did with I have a younger brother who's 3 years younger. You'd love him, he's great. But the joke in the company, my dad's company, and it was an industrial supply tool company, so he had trucks, he had warehouses, he had office people, But everyone used to say, wait till the summers when the Fowls boys come around for all the dirt work, for scrubbing the warehouse floors, for dusting the bins, for doing every grunt job that you could think of. And I used to go, oh God, this really stinks. I mean, but I look back on it very fondly. It was some of the best experiences. And that sort of, and the other thing is I learned my dad had me work in every part of the business. So I knew what it was to ship on the trucks. I knew what it was to do the accounting.
Yeah.
So, and I loved it. I absolutely loved it. And when it came time to, back then it was like, hey, son, go be a doctor and live on the house on the top of the hill, And I didn't want to. and in fact, I started out in college. I was an English major and a philosophy minor. And but then a light went on at some point, and I was really interested in I wanted to help people is what I wanted to do. That's what really changed, and so I finally sought my dad's way.
Okay. Well, do you feel like having to do some of that, grunt work that you said of like cleaning and dusting and doing all those things, do you feel like learning hard work in your youth really helped you to be the success that you are today?
Absolutely.
What do you feel like you learned from that helped you so much?
I learned that sometimes in this life that things happen that you don't like doing, but you just got to do them. You just have to do them.
I think that's wise.
And the other thing it really taught too was, he had a very diverse workforce. I mean, it was very diverse. And so my brother and I, who were just in high school, worked with all these different types of people. Some were easy to get along with, some were not so easy to get along with.
Yeah.
But you had this great experience, and I look back on that as more valuable than any of the formal education I had. Because even as a doctor, there's the technical part, but then there's the human part. And to be a really decent doctor, you got to be able to do both.
Yep.
And I learned some basic life skills from my dad from that work.
Yeah, being able to communicate, I'm sure it was one of the most important things that you learned for your career. Well, not just in healthcare, but in business.
One of the best things I learned was how to drive a truck. and the guy who taught me he's a great guy. I still remember his name, Ellis. And Ellis used to roll up his cigarettes in his T-shirt. And so I was a pet, but then it came time for me to learn how to drive. So I did. And I was going up this hill, and I saw this smoke coming out from the back of the truck. I'm like, and he's laughing. He thought it was the funniest thing he's ever seen. I go, Ellis, what's so? He goes, you forgot to take off the parking brake. But it's little things like that. The other thing is you learn some humility.
Yeah.
My dad was the president of the company, but this guy was a truck driver, was teaching me how to do things like, oh my God, he knows some stuff. I need to listen to him.
Yeah.
And really lets you know that different people have valuable roles in different parts of an organization.
Well, and I think that the other point to that that's really important is, as long as you're open to learning, you can learn. Yeah. As soon as you think like I'm better than this or you can't teach me anything, you've closed yourself off from progressing. Yeah. Like one of the most important things for growth in life is being open to learning from anyone. And when you stay open, you can continue to grow.
Yeah, yeah. And I think, it's interesting. I mean, the internet and everything that we got coming at us these days, there's some downside, but the upside is I've people are a little more open. Some have closed off for sure, but people are like, oh, I had no idea that this was going on. I had no idea that some people who are depressed, it's actually biological through no fault of their own. It's just that the clock went off in their brain, and this is what happened.
Interesting.
And if they get treated with antidepressants, they get and some people who 20 or 30 years ago used to be like, well, no, they're just crazy. Now are like, oh no, there's an openness and a willingness to learn more about this. And I think some of that has been driven by the opioid epidemic, actually.
Yeah.
Because people have, unfortunately, had some bad experiences, including losing loved ones, and that opened your eyes some.
Yeah, I think, to quote Ted Lasso, stay curious, right? Like, if you stay curious, there's a lot that can be learned.
Well, yeah, that's for sure.
Okay, well, as we're wrapping up, the last question really I have for you. So we've talked about a lot of different things, from insurance companies to the opioid epidemic and even to a lot of mental health stuff. I want to kind of close on talking about the mental health stuff for a moment. So anybody that may be hearing the podcast or listening that maybe resonated with some of those things that you said and said, you know what, maybe I need help. I'm dealing with some emotions. I don't know what the next step should be. What would your advice be to them of what are the next steps that they should take?
Boy, I wish I had a better answer for you than I do, because and this is a national problem. It's not just an Arizona problem, but our system is so fragmented, and there's such a lack of communication at that point. So if you're someone, I hear this all the time, because I get calls and say, "Hey, help!"
Yeah,
and I'm able to refer, but typically someone say they have a child with autism,
yeah,
and they don't know what to do. Who do I call? It's not like there's a directory or a 1-800 number or something that you can go to it and know. It's word of mouth at your doc, and it's sort of hit or miss.
Yeah.
And so one of the things I've actually encouraged, I'm part of the Psychiatric Society here, and we're starting to work on this, but one of the things I've encouraged is create a directory and a phone number, so someone can call in and say, "Hey, I have this problem. Who can I go see?" That's now, the problem when you're with an association is everyone wants to be part of that, and so the quality checks. You want to refer people to good people,
absolutely,
and not to a scoundrel, so to speak. And so that's one of the issues that we're dealing with. But now one of the things that managed care can do, and at Value Options we used to do, was exactly that.
Direct people.
Yeah. We had an assessment referral center, so you could call in a 1-800 number. We had people who would triage. They'd say, "Okay, what's your problem? What's driving?" Okay, I think here's some names of people that we think can help you in your geography.
Yeah.
And it was a good start. It didn't always work. It didn't always work out, but it's a good start.
Yeah, I would say, if I was to summarize some of the things you've said today for advice for people that are, dealing with mental health issues or dealing with emotional issues and don't know where to go, the one thing that you said that I think is great advice for everybody is be courageous enough to start asking for help. And it could be asked for help from family members, it could be asked for help from friends, it could be asked for help from your primary care, but it's have the courage to start asking, and with those referrals you'll end up where you need to be, and it's at least that's a way to start.
Yeah, and don't think that you're the only person who has the problem. We're all human beings, we all have feelings, then that's one of the things that's becoming apparent, is that behavioral health problems used to be someone's problem way off.
Small niche that you never see.
Yeah, 2 or 3 neighborhoods over the way, and it's those folks. Now, if it's not next door, it's within one's own family.
Agreed.
And so people are a lot more, and so it's a stressful world. Everyone's got problems. Yep. And you're not alone. You're not the only one who's a lot, and people are asking for help a lot more than they used to.
I love that. You're not alone. I think that's, it's easy to feel isolated and alone when you're depressed and you're in that situation. And that's another great piece of advice to take with people is you're not alone. There is help out there. Just start asking.
Yeah.
So.
Yeah.
Well, thank you so much for coming on today, Dr. Fowls. It's always a pleasure to have you and to talk to you and everything like that.
Yeah, you too.
We'll obviously continue some additional great conversations that this has sparked some ideas in, but really great to have him on. Thank you, everybody, for this wonderful episode. So thanks.
Thank you. Appreciate it.
Okay, bye.